So, Dr. Macie, I want you to tell us 3 or 4, maybe even 5 steps. Let's just say, heaven forbid, hypothetically, a family member, an aunt of mine, gets diagnosed with dementia, and I'm the caretaker, Dr. Macie. What is the very first thing that I should do?
The very first thing I think that you should do is find out what type of dementia it is.
Yeah.
So there are over 100 causes of dementia. Alzheimer's disease is the most common type. Then there's vascular dementia that comes about as a result of having several mini strokes, causing vascular lesions to the brain. Then there's dementia with Lewy bodies. Then there's frontotemporal dementia. We've been seeing that a lot in the news lately with Bruce Willis, with Wendy Williams. So because sometimes it may not be a progressive type of dementia because we have what we call pseudo dementia or faux dementia or treatable dementia, whereas that dementia is caused by medication side effects, medication interactions. You know, our senior population, they have several different doctors prescribing several different medications for the same thing. Because the doctors aren't talking to each other. So it could be medication-induced dementia, it could be substance abuse-induced dementia, alcohol, marijuana. I mean, I know sometimes it helps, but I'm just saying, I don't know.
I didn't know that.
Yeah, I mean, it just depends. It depends on you and what your body can take and what your body needs. Lack of sleep. Adults should get anywhere from 8 to 10 hours of sleep every night. If you don't, then that's going to affect your cognitive ability. Depression looks just like dementia on someone who's over the age of 65. And so what happens is, especially in the Black community, Black people are 2 times more likely to develop Alzheimer's and progressive types of dementia, but least likely to be diagnosed in the early stages when the medications are most effective, because we chalk it up to, oh, that's just old age, or, oh, it's gonna pass, or what have you. And so depression can be treated. So that's the very first thing I'll ask. That was a long way to answer the question.
No, that's
what type
great.
of dementia it is. Once you figure out what type of dementia it is, and they've done the full workup, seen a neurologist, done at least 2 cognitive assessments, and it actually is Alzheimer's or dementia, get connected to the Alzheimer's Association. Get connected to support groups in your area through the Alzheimer's Association. If it's a different type of dementia, the Alzheimer's Association handles that as well. Then I need you to get connected to your Department on Aging. Every county has an area agency on aging. We call them AAAs. They have vouchers for respite, so they give you money to pay for someone to come into the home to take care of your loved one while you take a break. You may want to go on vacation. You may want to get your nails done. You may want to have me time, which you have to. The AAAs. There's also Meals on Wheels. Just think about if the caregiver is working, the person who brings the Meals on Wheels, they also provide a sense of engagement and company for the person. And so that's gonna help the person get connected to resources and stay connected to resources. Then I need you to get your team together. And when I say team, I mean the family members. A lot of times family members are afraid. They don't wanna be the caregiver because they don't know what it entails. And so when I do family consultations, and I do it across the country, thanks to the power of Zoom and technology, it's important to identify the roles that each family member would play. Your logical family and your biological family, right? Because you know you got some play cousins, play aunties that come in and tear it down. You know, and so I help identify the strengths and the weaknesses in each one of the players, and you identify, well, you're good with money, but you don't have the patience. So you can't come over here every day trying to help mama eat or cook or remember things, because you're gonna get on her nerves, but you can manage her finances. You can manage the prescription medications, right? So that's vitally important. Once you do that, and you have that team, you have your resources, you have your community, if you have trouble doing that, then you would want to reach out to a third party like me, a geriatric care manager. You know, sissy don't have to tell brother what to do. I'm gonna tell him what to do. And that keeps down the strife in the family.
Oh my, I'm done. I'm done. Why aren't you a millionaire yet? You will be.
Oh my God.
Let me tell you something, Dr. Macie. You certainly spoke to our hearts and souls today. Seriously, I mean, you guys have to get your hands. I'm trying to get through the rest of this interview without crying. Dr. Macie took me there. You got to get your hands on this piece of gold, you guys. A dementia caregiver called to action. It's the journey. the journey of a dementia caregiver call to action. Dr. Macie, I personally can't thank you enough. You are needed in our community. I love that you are a woman. I love that you are an African American woman who is educated, who is bringing awareness and help and light and accuracy and hope to such an important topic that folks are really ignorant in regards to. Ignorance simply means you're unaware. You're you are just simply unaware, and that's why you're right. That statistical analysis is correct. That's why Black people that's why we are 2 times likely to get it more so than others. So please, you have to leave us with this.